Hello everyone, in this video we are going to discuss about clinical significance of brachial plexus and various brachial plexus injuries. So we know brachial plexus is a plexus formed by C5 to T1 roots which forms the trunk, upper, middle and lower, and it is divided into anterior and posterior division. All the posterior division forms the posterior cord, anterior division of the upper and middle trunks forms the lateral cord, and the anterior division of the lower trunk forms the medial cord, and the 5 terminal branches are musculocutaneous, axillary, radial, median and the ulnar nerves. And we have also seen the nerves arising from various levels from roots to the cords. So coming to the clinical significance, first is Erb's palsy. It occurs in the upper trunk injury. Wherever there is a birth injury or any fall on the shoulder, suprascapular, axillary and musculocutaneous nerves are majorly affected. In this, the baby or the patient will have a waiter stiff posture, and also that is waiter stiff posture is nothing but arm hangs by side and internally rotated arm and externally rotated elbow. Here we can see internal rotated arm and externally rotated elbow. This is Erb's palsy. Next is Klumpke's palsy. It occurs due to lower trunk, when the lower trunk is injured. Whenever that is like common causes pulling arm during delivery, hanging from a tree. Whenever during delivery we forcefully pull the arm of the baby, the lower trunk is affected, leading to Klumpke's palsy. Here ulnar and the median, that is low nerves are affected, and claw hand will be the clinical feature. And also weak grip along with sensory loss on the median hand we will see. This is the claw hand deformity seen in Klumpke's palsy. Next is complete plexus injury. It occurs during severe trauma. Here all the branches from C5 to T1 are affected. Here flail limb or no movement of the limb along with total sensory loss is seen. Next is long thoracic nerve injury. Here the long thoracic nerve injury, we will see the damage to the long thoracic nerve due to any surgery or trauma. Winging of the scapula is the main feature. Here we can see winging of the scapula. The test is wall push-up test. Here we can see winging of the scapula. Next is thoracic outlet syndrome. Here also lower trunk is affected, C8 to T1. The compression of the cervical rib or scalene muscle. The lower trunk is actually compressed by the cervical rib or the scalene muscle. Because of this compression, there will be thoracic outlet syndrome, and lower trunk weakness will be there, weak hand muscles and tingling and numbness of the hand muscles. Next is Saturday night palsy. Here radial nerve from the posterior cord is injured because of compression of the radial nerve in the axilla. Whenever the person sleeps on the arm, here radial nerve will be compressed, and wrist drop with weak finger extension is the main clinical feature. So lower trunk injuries are two, that is thoracic outlet syndrome and Klumpke's palsy. Upper trunk injury is Erb's palsy. Complete plexus injuries from C5 to T1. Long thoracic nerve is C5 to C7, and Saturday night palsy is radial nerve injury from the posterior cord.